So I'm pretty sure many of you might be asking, all right, can you guys image stifle on these horses with this machine? We cannot do stifling standing horses, obviously. However, we are starting to look at the possibility of imaging stifling recumbent horses. This is a video, a 3D reconstruction of a horse that we did. This horse, the picture on the left, it was a recumbent horse. So the company is working on opening up the gantry, reshaping the gantry a little bit. So hopefully this joint will be, this joint and the most caudal aspect of the neck will be imaged without major difficulties in the near future. We also started to look at the use of intravenous contrast. This is just an example of a case. This horse had a lesion in the proximal aspect of the suspensory ligament. The video on the left is a 3D reconstruction with of a venogram. So this horse, at the time this image was acquired, this horse had a tourniquet above the carpus. And the image on the right was acquired after the tourniquet was removed. So again, the contrast was injected in the vein. And we notice contrast enhancement in the proximal suspensory ligament of this horse after removing that tourniquet and re-imaging the horse. So to finalize, I'd like to thank everyone who joined us today and say that the standing CT can also be used for other species. This was the very first farm animal that we evaluated with CT. Since then, we have used in several other animals. And this particular case was quite useful, as it is in most cases, because this goat that developed a severe lameness on the left front limb, and it was radiographed in the field with beautiful radiographs. And unfortunately, no fracture line could be seen on those radiographs. And they're very good quality radiographs. So we decided to CT him, and he stood quite well. It was quite interesting to do him. And we found that articular fracture on the lateral claw, on the P3 of the lateral claw on the left front. The case was managed with a block placed on the medial claw, and he did very well after a few weeks with that block. So this tool has been definitely beneficial for us and for our referring veterinarians to diagnose and choose the best treatment options, and it can be used for other species as well.